It's come to light that senior Irish doctors are being trained in how to perform the gruesome late-term abortion procedure known as dilation and evacuation, despite repeated promises made during the abortion referendum that this would not happen. This is Ben Scallan and you're watching Gript Media. So yes, Irish doctors are now being trained in how to perform late-term abortions according to a new report by doctors who support said abortions. If you were a yes voter during the referendum who voted on the basis of some very restrictive, controlled abortion regime, this may come as a real shock to you, considering the leader of our country at the time, Leo Varadkar, tweeted this just before the referendum. A yes vote does not mean that there will be no restrictions. There will be a waiting period of 72 hours for reflection and counselling. Terminations beyond 12 weeks will remain illegal except in very specific circumstances. Late-term abortions will be illegal. Varadkar said this on April 21st, 2018, a month before the referendum. So how exactly did that work out in practice? Well, a new report is after confirming that senior Irish doctors are undergoing, quote, international training in a controversial late-term abortion method known as dilation and evacuation. This study, which was examining the stigma experienced by abortion providers, noted that certain surgical methods of abortion may, quote, drive stigma, and that dilation and evacuation has also been suggested to be highly stigmatizing. It also said that while the procedure is not yet offered in Ireland, senior trainees are undergoing international training in the procedure with a view of offering it in the future. So what exactly is dilation and evacuation? Well, its stigma is well earned, I would say. This is a horrible late-term abortion method which can be used on unborn babies up to 6 months gestation. In short, the woman's cervix is dilated by the doctor and then the baby inside is removed piece by piece using a combination of suction and forceps. This whole procedure can take around 30 minutes. And before you think, oh, we're talking about a clump of cells here, right? This is just some blob or zygote that we're talking about, isn't it? This is what an unborn baby looks like at 5 months. This is one of the earliest born premature babies in the world at 21 weeks or just over 5 months, born in Texas. Does this look like a clump of cells to you? When we talk about abortions at 5 or 6 months, this is what we're actually talking about in reality. And by the way, as a brief aside, that little premature girl named Lila actually went on to survive. Here's her at the age of 4 back in 2018. In fact, literally just in December of 2020, a baby boy named Richard Hutchinson was born alive at 5 months in Minneapolis, and this was him. And this is that same baby, Richard Hutchinson, 6 months later, alive and well. So keep that in mind based on what you're about to hear, okay? Don't let anyone tell you that this is a tiny clump of cells or an embryo. You've now seen with your own eyes what a 5 or 6 month old unborn baby looks like. So with that said, listen to this clip by Dr. Anthony Levatino, a former abortionist who personally performed 1,200 abortions during his career.
My name is Dr. Anthony Levatino. I'm a practicing obstetrician gynecologist and I've performed over 1,200 abortions. Today I'm going to describe a second trimester surgical abortion called Dilation and Evacuation, or D&E. A D&E is performed between 13 and 24 weeks of pregnancy. After administering anesthesia, the abortionist uses a weighted speculum, like this one, that opens the vagina widely. Because second trimester babies are so large, this greater access facilitates a late-term abortion. Late-term abortion requires that the cervix be prepared 24 to 48 hours in advance with laminaria. Laminaria is a type of sterilized seaweed that absorbs water over 8 to 12 hours and swells to several times its original diameter. Once removed, metal dilators can be used to further open the cervix as needed. Once the cervix has been stretched open, the suction tube is placed inside. A baby at 20 weeks gestation is as big as the length of my hand, from head to rump, not counting the legs. The suction machine is turned on, and pale yellow amniotic fluid surrounding the baby is suctioned out through the catheters. With babies this big, they don't fit through catheters this size. The baby's bones and skull are too strong to be torn apart by suction alone. This is a Sofer clamp. A Sofer clamp is made of stainless steel. It's about 13 inches long. The business end is about 2.5 inches long and 1/2 inch wide, and there are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. The abortionist uses this clamp to grasp an arm or leg. Once he has a firm grip, the abortionist pulls hard in order to tear the limb from the baby's body. One by one, the rest of the limbs are removed, along with the intestines, the spine, and the heart and lungs. Usually the most difficult part of the procedure is extracting the baby's head, which is about the size of a large plum at 20 weeks. The head is grasped and crushed. The abortionist knows he has crushed the skull when a white substance comes out of the cervix. This was the baby's brains. The abortionist then removes skull pieces. He removes the placenta and any leftover parts of the baby with a curette, scraping the lining of the uterus for any remaining tissue. The abortionist then collects the baby parts and reassembles them to make sure that there are 2 arms, 2 legs, and all the pieces. Once all the parts have been accounted for, the abortion is complete. For the woman, this procedure carries a significant risk of major complications, including perforation or laceration of the uterus or cervix, with possible damage to the bowel, bladder, and other maternal organs. Infection and hemorrhage can also occur, which can even lead to death. Future pregnancies are also at greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix.
I think that basically speaks for itself, doesn't it? I'm not sure there's anything worthwhile I can add at this point. And this is what Irish doctors are being trained in overseas. You see, when Simon Harris was legalizing abortion in Ireland, he didn't outlaw late-term abortion methods. In fact, it's a known medical phenomenon that unborn babies feel pain during abortion procedures, possibly more pain than you or I can feel. As Professor Colleen Malloy, a neonatologist and pediatrician at the Northwestern University Feinberg School of Medicine, told a US government committee, there is ample biologic, physiologic, hormonal and behavioral evidence for fetal and neonatal pain. In fact, by 20 weeks post-fertilization, the fetal brain has the full complement of neurons that is present in adulthood. Moreover, the fetus and neonate born prior to term may have an even heightened sense of pain compared to an infant more advanced in gestation. There is ample evidence to show that while the pain system develops in the first half of pregnancy, the pain modulating pathways do not develop until the second half. Under later questioning, Professor Malloy confirmed that the ability of the fetus to feel pain was the majority view of those in the field of neonatology. Neonatology, for those who don't know, is the field of medical study pertaining specifically to babies. And yet when Irish pro-life TDs pleaded with the government to offer humane pain relief for babies in late-term abortions so that at the very least they didn't have to experience excruciating agony during the procedure, their cries were rejected. There will be no pain relief offered in this country. This is what the abortion lobby is bringing to our country on the back of broken promises and dishonest campaigning. Last year, we learned that doctors were already carrying out feticide, where the unborn baby is given a lethal injection into the heart. One of the doctors involved described it as stabbing the baby in the heart. That's his words, not mine. Now we know that doctors are being trained in the equally horrifying practice of dismemberment abortion. There was nothing compassionate in any of this, and if the truth had been heard before the vote, it's certain that most people would have voted no, as several individuals have already said. It's time for TDs to ensure that late-term abortion, which most people oppose, is banned, and to be frank, it's hard to look at what Dr. Anthony Levatino has described and disagree with that statement in any way. Please like and share this video, and if you enjoyed it, please consider signing up for a monthly donation via the link on screen to help us produce more content like this. Alternative media like Gript needs all the assistance it can get, and every donation goes a long way. As always, thanks for watching.